Hello everyone. Today, we're delving into the world of a medication called Oxazepam, commonly known by its brand name, Serax. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Oxazepam, often recognized by its brand name Serax, is an oral medication that belongs to the benzodiazepine class of drugs. Its primary function is to act as an anxiolytic, which means it is prescribed to help manage anxiety and certain related conditions. Oxazepam is also known for its sedative properties, making it effective in promoting relaxation and reducing symptoms of anxiety disorders. It's typically prescribed for short-term use to alleviate anxiety and insomnia, as well as to manage symptoms of alcohol withdrawal. Warnings: Oxazepam comes with its set of precautions. It should not be used by individuals with a history of allergic reactions to benzodiazepines or any of its components. If you have a history of substance abuse or addiction, you should exercise caution when using Oxazepam, as it can be habit-forming. It's essential to inform your healthcare provider about any other medications, supplements, or herbal products you are taking to avoid potential drug interactions. Before taking this medicine. Before starting Oxazepam, there are important considerations to keep in mind. You should inform your healthcare provider if you have a history of allergies, especially to benzodiazepines. Additionally, discuss any history of substance abuse, alcoholism, liver disease, kidney disease, or any other relevant medical conditions. If you are pregnant, planning to become pregnant, or breastfeeding, it's crucial to consult with your healthcare provider, as Oxazepam may affect the fetus or nursing infant. Side effects: all medications can have side effects, and Oxazepam is no exception. Common side effects may include drowsiness, dizziness, headache, blurred vision, dry mouth, and changes in appetite. Some individuals may also experience gastrointestinal symptoms like nausea or constipation. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual or severe symptoms. Furthermore, Oxazepam may cause serious side effects, such as paradoxical reactions, opposite of the desired effect, memory problems, mood changes, difficulty speaking, coordination problems, and allergic reactions. It's important to seek immediate medical attention if you experience any of these severe side effects. Interactions: Oxazepam might interact with other medications, especially those that depress the central nervous system, such as alcohol, sedatives, and certain antipsychotic drugs. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Oxazepam. The recommended dose of Oxazepam for adults with anxiety or insomnia typically ranges from 10 mg to 30 mg, taken in divided doses throughout the day or as a single dose at bedtime. Your doctor will determine the appropriate dosage based on your specific condition and individual response. Do not exceed the prescribed dose, and never alter your dosage without consulting your healthcare provider. Avoid: while taking Oxazepam, it's advisable to avoid activities that require mental alertness, such as driving or operating heavy machinery, as the medication can cause drowsiness and impair coordination. As with many medications, it's recommended to avoid alcohol, as it can exacerbate the sedative effects of Oxazepam and increase the risk of side effects. FAQ: many wonder about the duration of Oxazepam treatment. Typically, Oxazepam is prescribed for short-term use, usually no longer than a few weeks, to manage acute anxiety or insomnia. Prolonged use should be avoided, as it can lead to tolerance, dependence, and withdrawal symptoms. Your doctor will provide guidance on the appropriate duration of treatment based on your individual needs. Closing: that concludes our overview of Oxazepam, also known as Serax. Remember, this information is intended for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.